Welcome to Omnia Health Insights. Joining us today from Fakeeh University Hospital are Dr. Hosam Qudah, Consultant Urologist, and Dr. Omer Derish, Consultant Urologist from the Urology Department. Thank you so much for joining us today.
You are welcome. Good morning to you, Fatima. Good morning, Bahauna and Mariam. And good morning, Omer.
Good morning, everybody. Yes, good morning, everybody, and thanks for giving us this opportunity, Fatima.
Thank you very much. So today the topic is quite important. We're discussing about prostate cancer. And my first question is, have there been new advancements in the prevention, detection, and treatment of prostate cancer?
Thank you for the question. It's a very long question, this one. Now, for prevention of prostate cancer, there's lots of studies that show that prostate cancer we can decrease the chance of having prostate cancer by being a healthier person, by eating a low-fat diet, not having a full-fat diet, eating less red meat, having less dairy products, exercising every day, also having good amounts of fruits and vegetables, having perfect weight or don't have obesity, also decrease the chance of having prostate cancer. There's lots of supplements and vitamins that are in the market, but there is no really good study that supports the use of supplements. But at least if I have to use, I will use healthy things that may decrease the chance of having prostate cancer. This is for the prevention. Detection of cancer, it's still the same way of detection for the last few years. The only thing different, we'll talk about it later, is the more use of MRIs now before we diagnose the patient with prostate cancer compared to the past where we depended more on ultrasound and biopsy to diagnose prostate cancer. I think this covers the first question. For treatment, the newer treatments really, we have more and more application of localized treatments, like they are using it more and more, but still the standard of care is still doing the surgery for the prostate when it's localized, or radiation therapy. And both of these are available here in UAE and in our part of the world, using more minimally invasive robotic and laparoscopic treatments for the prostate cancer. The newer treatments, the localized treatments are like what we call them high-flow, cryo, or radio frequency. These are they are not the standard of care. And the standard of care is still the surgery and the radiation therapy. The newer treatments also is in the metastatic or the advanced prostate cancer. There's lots of new, I would say, chemo and immunotherapies that have been used and approved to improve this patient's survival and improve his quality of life when he is diagnosed with a metastatic prostate cancer.
So just moving on to the next question. For patients who have inherited genetic traits like BRCA and Lynch syndrome, is there recommended guidance when it comes to screening?
Thank you again for this question, because screening of prostate cancer is one of the actually difficult issue and debatable issue until now in the urological community. Basically because there has been two big or large studies conducted in the US and Europe looking at the benefit from screening or mass screening for the early detection of prostate cancer. And the outcome has been controversial. The European study showed that there is mortality reduction up to 29% if we screen men for early detection of prostate cancer, whilst the American study showed no survival benefit from early detection. Going back to your question, we know that from epidemiological studies that familial or family history of prostate cancer increases your risk of having the cancer, as well as there is increased risk in certain ethnical groups, such as the Black Africans. And hence, there is some genetic or gene mutations that can predict the incidence of prostate cancer. One of them, as you correctly mentioned, BRCA1 and 2, and Lynch syndrome. There is no strict guidelines regarding to this, but there are packages that we can use for patients who are at high risk for prostate cancer. And the main, as we know, a tool that we use for early detection, in addition to targeting certain ages, starting at the age of 45 if you have family history, and then after 50, generally speaking. So for those patients who are at high risk, by detecting high PSA and using specific threshold, as well as clinical examination, then we can use the genetic studies to predict the risk of having prostate cancer.
And some researchers are using magnetic resonance imaging, MRI, for prostate in men at high risk to learn more about how often and how early these cancers occur. So we were just speaking about how tech and radiation are still new, they're not standards in urology. Can you comment more about this and expand on this question?
Thank you. MRI now, as we said in the beginning, it has been used more and more for prostate cancer. It is good for diagnosis, for staging, and for follow-up of patients with prostate cancer. We use MRIs now in almost all patients before we do the biopsy of the prostate cancer. It can detect as small as like 5mm nodules in the prostate, and it can stratify risk of when you find some nodules in the prostate, are these benign or cancerous? There is a staging class, or there's a classification for them. We call it PIRADS classification, that tells me should I do a biopsy or I should not do a biopsy for that lesion. Before the common use of the MRI or the extensive use of the MRI, we were taking the patient depending on the ultrasound and the PSA to do a biopsy of the prostate. Sometimes we biopsy patients who don't need a biopsy, and so we overuse the biopsy, and sometimes we may avoid doing a biopsy because the patient has a low PSA, it's not that high, depending on the rectal exam. Now the MRI can show us even small nodules that are present there. So the use of MRI, I would say it triaged the patient who should do more invasive things like doing a biopsy. Even now we have what's called MRI fusion biopsy. The MRI can guide me during the biopsy itself where to take the biopsy from, which improve our results for prostate cancer detection. So it's an important role. Now the important thing is also to do the proper MRI. There's lots of, because the MRI machines differ from one to each other. The newer generation MRI, which are the 3 Teslas one, are the ones that should be used for this purpose, not the old machines that don't get these good quality pictures and will be unable to determine the patients who have prostate cancer.
So we just spoke about the treatments earlier as well, and just in line with that, what are the best treatment options for patients who are at risk of contracting prostate cancer or who have been diagnosed with it?
Well, as Dr. Hosam alluded to earlier on, the treatment, of course, depends on the stage of the disease. So the first actually step we need to do is to stage the disease. Is it localized, locally advanced, or metastatic? For localized prostate cancer, the gold standard, of course, is either surgery, which is removal of the whole prostate and associated glands, and sometimes part of the lymphatic system, or radiotherapy. In terms of the radical surgery or removal of the prostate, we know the most advanced now technique is using robotic assisted prostatectomy, where we have a detailed view of the prostate, as well as using this robotic assisted technique allows us to have more detailed and precise resection, as well as reanastomosis of the urethra to the bladder. And this theoretically, and some studies show that this improves the the tumor control outcome as well as functional outcome. And the main two issues, as we know, is the control or the risk of urinary incontinence and risk of sexual dysfunction. And the robotic surgery allows us to optimize these outcomes. In regards to the other techniques, as Dr. Hosam mentioned, is the focal therapy, where we can target if the patient has early stage prostate cancer and is localized, then we can target the focus of the cancer without damaging the rest of the tissue and minimizing the local side effects. In regards to the metastatic prostate cancer, again, the gold standard, as we know, is hormonal therapy, because prostate cancer depends on the male hormone testosterone for the growth, and we target this hormone to control the cancer. Unfortunately, when the cancer is metastatic, the aim is to control, and the cure rate is low, as we know. But to try and optimize the treatment, we use most of the time now combination therapy, where we can upfront start with hormonal therapy in addition to either chemotherapy or second-line hormonal therapy, as well as immunotherapy. So the treatment, as I mentioned, depends on the stage, but also based on the studies in Europe, hence the early detection and the advancement in the treatment, the cure rate as well as survival rate is improving day by day because of these or the progress that we have in the treatment. And this is reassuring to our patients as well.
And just with the treatment process, the road towards recovery and the whole journey towards, being diagnosed and then receiving treatment and then recovering can perhaps take a mental toll on the mental being of the patient. Would you agree to this or disagree to this? What are your viewpoints, and how can patients, be better supported and encouraged that the process that they'll be on?
Thank you. This is really an important question. Now, it's really a multidisciplinary service or multidisciplinary care of the cancer patient. I cannot speak, I'm a surgeon. Me and Dr. Omer, we are surgeons. We cannot say we treat the patients with prostate cancer like any other cancer. So we have to work with the medical oncologist, with the social workers, with the family of the patient. Everybody is supporting the patient with cancer. And we want him to make the right decisions in the right time. Lots of patients patients are afraid to do the screening. And we need first to encourage the patient to come forward, to man up and get tested for prostate cancer. When they are diagnosed with prostate cancer, they need to get treated. Lots of patients, once they are diagnosed, they think that they are going to die from this cancer and they should not really get any treatment. Prostate cancer, usually it's a slow growing cancer and the patient can live many years with it. So we need to get treated as soon as possible as we know that we have cancer. The family support, we really depend a lot on the family support. The good thing that we have all the treatments that we need, they are available. And we have good doctors, we have good hospitals, and the patient can be treated the proper way. It is done wherever they go in the world. Now everything is available here in UAE. We don't have to go outside the country to get the treatment. The important is really here is that everybody feels with the patient, everybody supports him. Us as surgeons, with all our teams, with the nurses, with the family, we can work together to put the patient in the right decision and in the right track to do the proper treatment.
So just to expand on the multidisciplinary approach that you just mentioned right now, so could you guide me through how a patient from their diagnosis, what are the steps that come in?
So the steps usually that comes in is once we see the patient as urologist, first patient is diagnosed with prostate cancer. We usually, as we said, we apply the case into a multi-MDT or a tumor board where we discuss the case with medical oncologists, with radiation oncologists, with surgical oncologists. Everybody, we decide together what's the proper treatment with this guy, and we come back to the patient. We discuss what does the team say. This guy should be going for chemotherapy, should be going for hormonal treatment first. He's more towards radiation therapy. So we tell him what's the ideal treatment for him. And the second stage is that once he gets involved with the treatment, it's not a one person who's following him. He has to see the medical oncologist, he has to see the surgical oncologist, sometimes the radiation therapist if he needs to go for radiation therapy. So it's not one person who's treating him all through the way. It's really it's a teamwork to treat the patient and give him the best treatment that he needs.
Absolutely. And
what do you think, Omer, about it's the same thing? If there is any addition that you'd like to add about this mental health for the patient?
Well, as Dr. Hosam mentioned, I would add something that maybe is not in place right now, but in Europe and in the UK when I was there, in addition to our support, the professional support, there are what we call patient support group, where patients who have had the experience with the diagnosis and treatment have their group for supporting others. So they can explain their experience, they can explain the treatment steps and whatever the patient can expect. So it improves the mentality and the mental health of the patient. In addition to that, as Dr. Hosam mentioned, is the family involvement and education is very important, because when a man who is maybe the main bread earner who has been affected by this disease, in addition to mental effect, it can cause physical effect in terms of the side effect of the surgery and treatment. Patients who are on hormonal therapy are very tired, they lose their energy, sometimes they lose their job, or maybe they have early retirement. So having a family who understands this and support the patient is very, very important in this situation.
Absolutely, and it can be very difficult to lose one's job, or have such a big significant thing happen in their life. So I've covered all my questions, and if there's anything you would like to add at this moment, in addition to everything we've discussed.
That's the final word, is that to advise every man above the age of 45 is really to come forward and get tested for prostate cancer. It's a very simple evaluation. It requires just a simple blood test, and sometimes we need to examine the prostate by a simple test, and we'll be able to understand the risk for the person, especially if he has a family history of prostate or breast cancer. These men should come forward and get tested for prostate cancer. And thank you.
Thank you very much